we're going to start with having you tell us a little bit about how you got into gynecologic surgery.
Well, I got into GYN surgery. Obviously, I went into OB/GYN first, and a lot of us went into that field for a lot of the usual reasons. It's medicine and surgery and promoting women's health and that. But particular for GYN surgery, I think for me, it was really the influence of my chair at that time, who was David Nichols. And he obviously is a very well-known, internationally known vaginal surgeon who wrote many books. And it was fascinating for me to see what he could accomplish through the vagina, really. And I still maintain that vaginal surgery is one of the few things that distinguishes us from general surgery. So I think that is really what really intrigued me to go into urogynecology, really. So, yeah.
Tell me a little bit about what it was like to sort of emerge into this specialty when women surgeons were uncommon. Was it different? And do you see how have things changed, and do you still see some inequities?
Well, in OB/GYN even, there weren't too many women at that point. So you had to develop kind of a thick skin, had to work hard, earn the respect of your colleagues, both male and female, actually. And so those were lessons that were a lot of us during that time frame had to, learn. Within Urogyn, it was still a relatively small field. And even though the societies were smaller, the women, I would still say, were somewhat separated. Not that we didn't want to be with each other, but we were busy enough trying to navigate, being on committees, being on the board, trying to get at the table, those kinds of things. So I think for us, we were kind of learning as doing, and not only later until now, which is what I see at, society meetings, is that there are so many more women present that a lot of that work has already been done, and now we can promote and support each other. So those are some of the differences I think that were back then from now. Yeah.
You mentioned somebody very important. Who else has sponsored or mentored you over the years?
Oh, for me, I would say Steve Young. Sadly, he has passed. He was my guru, I used to call him. Actually, my first chair, Donald Kustan, he gave me the, opportunity to be a division director, and that has really built or kind of shaped my career for a lot of my years. I had a lot of role models as well. I'm thinking of Dee Fenner, Nicolette Horbach, actually. She and I got to see each other again at the recent Urogyn meeting. Becky Rogers, for sure. They've given me lots of great advice over the years. And I will tell you also who's mentored me in a very different way was Andy Fantel. And that was more along the perspective of leading groups, leading organizations, and a big perspective on our field. He was also another important person I recently got to see again, too.
What would you say makes a good gynecologic surgeon?
Well, certainly good hands, good technique, knowing the procedure, things like that. But I would say it's really the decision-making that is needed. And that decision-making occurs even before the operating room. It is who you operate on, what procedure do you choose. Then in the operating room is somewhat taking control of the room. You are responsible. And how to avoid complications, how to manage them when they occur. And the other thing is to know when to finish, get out of Dodge, I call it. So knowing when you've done enough, you have to leave, be finished. Yeah.
Yeah, somebody once said to me, in the obvious, right, is this doing the surgery, right, being talented with your hands, right? But the other part is how to manage your surgery day, right?
Yep.
Whether like how to manage everybody in the room, the learners,
Yep.
creating that environment that leads to good surgery, good outcomes, but also all of, it's an entire day, and each event sort of leads to the next. And that's really sort of the icing on the cake with a good surgeon. So I'm glad you mentioned that, because a lot of people have talked about sort of like the technical parts of it.
Yeah, it's more than that.
much more, right? That's the actual, the art isn't just what you're doing in surgery. There's the art of the actual practice
Everything
is
else.
everything. Yeah, for sure. I love the theme for this year's meeting, surgeons as change agents. What does that mean to you, and what changes have you seen in your career, and what do you think might be coming down the pipeline?
Well, things that I've seen, obviously, the subspecialty of, pelvic surgery or gynecology has grown. I would say even OBGYN in and of itself has grown. The expanse of knowledge is much more like than when I came through as a resident. And what I see and I worry about a little bit is that there's more knowledge. It's going to take more time to learn everything. And I worry about surgical training. That is my big concern, as that's what we do. And there are just not so many more ways of doing things now, more different approaches, vaginal, open, robotic, straight sticks, and people need to learn that. And the number of cases overall has gone down. So I worry about surgical training. And I think that it's going to be the surgeons who are the best people to know how that should look. And I think it's going to be up to us to really decide what needs to happen. So that's what I see our agency of change will be.
I think putting in also the pressures that we have now, right, in our medical systems, about OR utilization and time
Mhm.
efficiency, et cetera, also affects the way we train, or some of us train. And so if the onus is on us, right, to actually be those agents so that we maintain training and we maintain competency and proficiency, having to do it within the sort of pressure cooker system that currently exists is like an additional challenge, which means we really have to be agents at a whole new level, right?
Mhm.
Um, Shifting gears and talking about specifically about SGS, what role has SGS played in your career?
For me, SGS, was very important. I became a member back in 2000. Okay. In those earlier years of my career, it was an important society to be a part of. You had to present and still do, and be voted on, things like that. That meant a lot, still does mean a lot. And I think for me, it was really in when I was the program chair for Peggy Norton. It was 2007. And that gave me an opportunity for me to show my leadership, my organizational skills. And that really set the tone for my career path, to have other opportunities open up for me as well. So I was, very involved in a lot of committees and education at that. I had opinions, people heard me. So that was very important and really shaped, the rest of my time. So yeah, it's a great organization.
What keeps you going back to the meetings?
Oh, the people. And I think the focus of the mission is the other piece, that, with things that we've just talked about, surgical training, things like that. I think those are things that are important to the society, important to me, I think important to all of us as well. So keeping that focus, and it's still a relatively close meeting where you get to see people, network, catch up with everybody, bring on new ideas. So I think that's a lot of it too.
Yeah, a lot of the Eurogynes that I've interviewed have said, I'm not supposed to say this, but I love AUGS and I look forward to AUGS, but I really look forward to SGS.
Yes, yes.
um, uh, any specific memories of SGS you want to share? Anything that comes to mind? I didn't prep you with that question, so that feels a little unfair, but I've asked people that.
Um, Specifically, there's some good ones and bad ones. I won't relate the bad one really, but let's just say that when I noticed actually there wasn't when you got up on stage, you had to present, and you had discussants, and then you took questions from the audience. So I kind of got blindsided one time there, so that wasn't a great memory. but my other good memories are, sitting outside behind the fire pits and, primarily in Tucson, Arizona. It's one of my favorite places, favorite meetings. So lots of good memories there. Hiking through the desert. I found old pictures recently, me, Steve Young, Chris LaSala, so all those kind of things.
So retirement is a new thing for you.
I'm in it.
You're in it, and
I'm enjoying it now.
And I've gotten to interview a few people who are in retirement. I've interviewed different people at different sort of stages, all of whom have contributed to SGS and GYN surgery. What's retirement look like for you right now?
For me right now, I'm only recently retired, so I'm kind of going through all my papers. For me, interestingly, when I was at work, I had to clean out my file cabinets, and I had a huge file cabinet. Each folder had a subject containing, like, urodynamics, one was stress incontinence, one was vault suspensions, things like that. And I went through it was like a fast forward movie of all the articles and things that had happened, all the devices that came and went, urethral injections that came and went. It was like going through a fast forward movie. And it really just like brought everything into focus, really, of how far we have all really come, from the very early days of, what we used to, present on, simple case studies, things like that, to, big randomized trials now. So it's really, it was very interesting for me. So I've had a chance to reflect. I guess that's the biggest word.
Yeah. Mark Walters clean out his office because his office was right next to mine, and it was fascinating how many folders we found. And it's interesting. I cleaned out my office, as you know, I changed jobs this past year, and I only did fellowship 13 years ago. I started fellowship 13 years ago, but I had all these folders that were also labeled like stress incontinence and everything. So I can only imagine, right? Add even more time. And I remember saying, like, my fellows don't even care about these folders anymore. Everything is so, they're not printing papers. Nobody prints papers anymore.
No.
It's funny. And so
I had reprints. We used to get reprints of your article. I was like, oh my God, I totally forgot about it. Yeah.
Yeah. But that office cleanup with helping Mark, I said, Mark, these papers, they're like yellow. The papers were yellow. It was funny. All right. Tell us about your favorite GYN instrument and why it's your favorite.
Now I know where this question came from.
Yes, you're right.
Dr. Hampton.
Yes.
For me, it's easy. I use the inside of a pool suction. Okay. It's a narrow piece that I operate with, really. I mean, once you're an attending, you don't really hold scissors and pickups anymore. So you have to operate, through other hands and operate in other ways. And for me, I've used the inside of the pool sucker. Once someone gets into the surgical plane, you can just push the tissue. It keeps the field relatively exposed because you're able to use suction. I rarely give it up in the operating room. If I do, it means you're like moving up a level in my world. So for me, pool sucker, hands down.
I don't use it for everything, but on my fine surgeries, I use the inside pool of it also. And that was a gift Matt Barber gave me, because that's like how that's the pool sucker he uses. He unscrews it and then uses the inside.
I must have told him.
Yeah, maybe. And it's funny. So that's what I use for some of my finer surgeries. So I love hearing that. I didn't know where maybe Matt had even gotten it from. But
I don't know. I'll claim it though.
You claim it. And when you have a new surgery staff, you have to say, oh no, you have to unscrew it. I only use the inside, inside.
Yes.
Amazing. You said that you had a joke. Do you still have that?
We'll give it a shot. Okay. I have to read it though. Okay. So,
okay.
All right. So this is a joke. It's, supporting vaginal surgery. Okay. All right. So a gynecologist was getting sick of her job, I'll say her, and decided that she needed a career change. She'd always enjoyed tinkering with the motorcycle engines, so she thought she should become a motorcycle mechanic. The good doctor went along to the American Institute of Motorcycling, the best motorcycle mechanic school in the country, and completed the training class. The final exam was to strip a bike engine completely and reassemble it, obviously back into perfect working order. So our gynecologist friend did the test and anxiously awaited the result. The day she received the results, she got quite a surprise. She got 150%. She quickly phoned the instructor and queried the mark. The instructor said, no, that's right. First, I gave you 50% for stripping down the engine. A very good job. Next, I gave you another 50% for reassembling it. A fantastic job again. But then I gave you another 50% bonus for doing it all through the muffler.
Amen to vaginal surgery. I love it. I'm not the one making these clips. Star's reviewing a lot of them, and so the rest of the committee is. I have the luxury of just doing the interviews, but I love it. That's wonderful.
Yeah.
I hope they end up using it, and it came through really well. So.